Let me introduce Melissa Collins. She is a writer, artist, medical provider, and mother of two. Her debut novel, The False Flat, which is a bittersweet love story, came out in June on June 11th of 2024 this year, and it is an Amazon bestseller. Congratulations, Melissa.
Thank
That is
you.
awesome for anybody, but especially for a debut novel. That's great.
Thank you.
So, in addition to writing women's fiction and bittersweet romance, she works as a surgical physician's assistant, or excuse me, associate, and is also a functional integrative healthcare provider. I'm not really sure what that means, but that's okay. Her stories, like her, are always a mix: light and dark, laughter and tears, outlandish and grounded, beautiful and ugly, glitter and charcoal smears. Let me get a few more people in here, just a second. And her interests are way too varied, like mine. Yes. Her imagination never fails to get her into trouble. Ha ha ha, I love it. And she lives by her life philosophy. Nothing is impossible and everything is better with glitter except surgical wounds. Thank you for joining us, Melissa.
Thank you for having me. I'm so excited to be here. This topic is near and dear to my heart, and I can't wait to see where we take it.
Okay, so first of all, I think we're going to be talking about how to add realistic and authentic medical issues into our novels. Is that correct?
Yes.
Okay.
Yes.
And I write historical, so maybe some of the things that you share won't be applicable, but I am in a scene right now where my hero has been stabbed. This is 1812. He was stabbed in a fight with a guy. The guy's dead, but now he is stabbed. And so it's the onset of winter, and the stuck together is that the heroine that he saved from being raped by the guys that he killed, she's helped him back to this abandoned cabin, and she's the one who's going to care for him. Where would I go with this? I mean, I kind of think I know where I'm going to go with this, but where would you suggest I go with this?
Oh goodness, because this is back when I don't know exactly what healthcare looked like back at that point in time. So I think this is a great place to start because when there are many ways you can incorporate medicine, within your novel. And you can have your main character be in the medical field, but in your case, and another way you can do it is your main character has a medical issue going on. And I think it's super important whenever you are putting that in your novel that you're accurate. So with your wound, you have to think about where did it go? What did it avoid? What did it hit? You have to think about, are there arteries involved? Are there blood vessels involved? Is he going to bleed out? Did they pull the knife out, or are they holding pressure? And then how is she going to treat him? She needs to clean the wound. She needs to see how deep it is. What does she have there? Does she have suture? Does she have any sort of bandages? And so back then, you worry, they didn't have good sanitation back then. So,
Mhm.
is he going to get infected? And so that I think that creates this realistic, because if somebody just gets stabbed and they have this gaping wound, it's not very realistic that they are able to do everything. I read somebody's work because this takes me out. Anybody who knows medicine, you're going to be pulled right out of a story if you do not get the accuracy, if you're not accurate in your medical description. I was reading a friend of mine's story where she had written something that was somebody had, I think their foot had been dissolved by acid. That's very modern, very contemporary, and it was a horror story. And I just got stuck on this guy goes about his business laughing and talking, and I thought, what? He just lost his foot. I'm thinking about all the things that could go wrong. And so I think that's a place where we can really get tripped up. So you need to think about all those surrounding bits. And I think when you do that, you need to find out, how is a wound treated, right? How is a wound treated today? How is a wound treated then? so that you can be accurate? And then how would it proceed from there? And
Well,
then,
let,
yeah, go
let
ahead.
me interrupt you here because I have worked on this a little bit. And
Yes.
I really had no idea I was even going to ask you this stuff, but since we're here, so I'm thinking to myself, instead of being a long blade jabbed into him, that it was probably more of a glancing slice,
Okay.
that was maybe deflected by a rib. That's what I'm thinking. And I know back in the day, a lot of times they would cauterize wounds. And I have read descriptions written in the time period of taking a blade, pouring some black powder on it,
Mhm.
holding it next to a wound and lighting the black powder and letting that cauterize. Does that sound realistic?
It does
I mean,
sound
that's
realistic.
what okay, that's what I read. And then also what I was thinking, and this is what I'm not too sure about, is you know, I think most people back then carried a tin of some type of a horse liniment, in
Hmm.
case their horse went lame. And would that, do you suppose, be something that would be good to put on the cauterized wound?
I think
I,
it
I don't
definitely,
know.
I don't know about that because this is, back then, but, and Shelly, I see your question. We'll come back to it. But one thing about cauterizing is you never want to cauterize that top layer of skin because then you can't heal the skin. You're cauterizing to stop the bleeding, but you want that wound back together. So I think whoever's doing this healing is going to cauterize, perhaps in the way that you said, and then get that wound back together with some sort of bandaging. Whether I don't know what they had then, but either we're taping it together or we're bandaging it where the two in those two pieces of skin where they were disconnected are connected without the cauterization in between. And then she might put something on top of it like that horse liniment to keep out any germs because any sort of liniment, any sort of like Vaseline or anything that's like that is going to help keep the germs out. It creates that barrier.
Okay, a
So that would be,
grease-based thing.
yes, yes,
Okay.
that would be the
All
thing.
right. Thank you for your help there because I was
Yeah.
pretty sure I was on the right track, but I wasn't positive. But it's nice to know that what you're saying on the cauterization, it doesn't like meld the skin together. It just
Nope.
stops the bleeding. So
Yep.
that's great to know. I didn't know that.
Cauterization. Yeah, that is all that that's going to do. And we still use that in the operating room today. It just looks very different. It's an actual electrical device. And it's not pleasant to smell either. Okay, Shelley had for contemporary romance novella, I have a male protagonist getting leg and arm broken in a motorcycle accident. I was told that long stays in hospital are no longer done, that hospitals send them home in casts. This is very true. It depends on if you have to think about when anybody has an accident, what is also happening. So in that break, think about the different aspects of a break. Was it a clean break or was it a compounded break? This would be, is this involving a clean snap of the bone where they're easily set back together? Did they break apart? Did it break the skin? Are there fragments? Is he going to need hardware to line the bones back up? Did he have surgery? Is it just a cast? Those things are all things that you want to think about when you have a break. And then if it was a motorcycle accident, how severe is it? Because those can have like skin breakdown where
Yeah,
you're
right.
road rash. Yes. And so do you want to add any details on that, Shelley?
Well, yeah, I wrote this a few months ago and I don't have all the details in my head, but I think I had the break not puncturing the skin, and I know he got scraped up. And originally I was going to make it so that it it hit his dominant hand so that he was more incapacitated. And I think I've got it with his right arm and his left leg. And I don't know
Okay.
if that's realistic, but anyway, somebody said, "Oh, you can't just let him stay around the hospital for days." My whole
No,
my whole ploy is that this woman who's a registered nurse practitioner, very competent, she goes in the day she comes back from her vacation. She's assigned to take care of him, and she's doing all these fantastic things to help him get what he needs. And he asked her if she'll come home with him and do private duty nursing. And he's very wealthy. So that's my kind of background for it. I had a blast writing it, but then somebody said, no, he can't stay around in the hospital for days while she gets to know him. No, they have to do this quickly. She goes looking for a bedpan and a whatever because nobody's there to help but her. And so he can't really get up and use the bathroom. He's just not in shape to do that. But he has a whole staff at home, and she's going to be there. And within a week or two, they're in love and all that good stuff happens. And hey, it's a short story. But I wanted to make sure it wasn't too off the mark. So I did change it so that he didn't wind up staying for several days. But
Yes.
I
If he
think they
stayed for
said if it
several
was,
days,
I think
he
they
would
said if
definitely.
it was how, excuse me?
Oh, I was just gonna say if he stayed for several days, which he could, there could be reasons where he would stay, but if it's a simple break where he doesn't have he would just need casting, then they would arrange for him to have home health or something where he would have help at home and then they would get him out of the hospital as soon as possible.
I
But if you
Somebody
wanted
said there
him to
was
stay,
one instance where they might stay longer, just blood pressure or something. If that
mhm,
was blood pressure. I think I had them stay for another day because they want to
I'm
make
going to
sure the
jump
blood
in
pressure.
here. I'm going to
Yeah.
jump in here, Shelley. I had a friend of mine a couple years ago. He was driving in a country road on a country road on his motorcycle with a helmet on. Could not have been going over 35 miles an hour, and he hit a deer. A deer jumped out right in front of
Ooh,
him, and he hit the deer. He was semi-conscious, in and out of consciousness. Um, he didn't break anything. His bike was totaled. Um, But because of that being in and out of consciousness, they did keep him in the hospital for a couple of days.
okay. But the
and
blood
they
And
pressure would
he
work.
was really hurting bad. And he doesn't remember maybe by this time he remembers a lot of it, but at the time I talked to him it was only a couple months old, and he said there was still a lot about the accident he didn't remember. His wife was riding her motorcycle right behind him and saw the whole thing happen, but he remembered asking her, how's the deer? And she said, the deer is going to die. And he kept trying to get his gun out, saying, you have to shoot it. You have to shoot it.
Oh
Because he
my
was
God.
conscious of that poor deer suffering. And she said it took a long time for the deer to die. And it would have been a mercy killing if she could have, but she says she just couldn't do it.
Yeah, I think
So,
Oh,
the blood pressure thing is my go because that could be stabilized pretty quickly, I think. Whereas what you're talking about, being in and out of consciousness, it wouldn't help my plot to get him to know her better if he's in and out of consciousness.
well, I
that's
mean,
So,
by the
true.
time
Yeah.
the ambulance got there, because it took quite a while, they were in the country. She had to flag down a car to go and call because she didn't have cell phone where they were. They were in a dip, you know.
yeah.
Um, by the time he got to the hospital, he was conscious and he was conscious out of that. But for about that half hour, 45 minutes until the paramedics got there, he was kind of in and out of consciousness a little
Okay,
bit.
okay.
So,
He had a concussion.
yeah.
But yeah, I mean, the
But
blood
thank you for the
pressure
input.
would be stabilized. He could have skin issues where he needed a skin graft or something like that, where they would have to do some plastic surgery and stay there where he would still be conscious and still talking to her. If he had to have hardware put in, then he wouldn't just go, he might not go home immediately. He might stay a little bit. Um, but she could also, if she's a hospitalist nurse practitioner, then you could change it to where she maybe even wasn't a hospitalist. She could be the therapist who helps him. I don't know if you want to change the medical provider aspect of it, but a therapist who's working with him, that would be a lot of hands-on, where they're together a lot when he's going through therapy. Just something to think about.
Okay, I may keep it the way I am. Once I found out that I had to kick him out quickly, I thought, okay, we'll go with that route. And she's going to do all these things behind the scenes that he's flabbergasted because he's been there a day or so. She just got back from her vacation.
What
And
did you say she's doing behind the scenes? Because that sounds stranger to me than a longer hospital stay.
oh, okay. No, she's getting things like bedpans when there wasn't one in the room, and stuff like that, just to
And
help.
a nurse practitioner wouldn't do that. A nurse would. but
Okay.
not a nurse practitioner. The nurse practitioner is going to be the one who orders that and isn't going to go find it for him unless she really likes him, because that
Well,
wouldn't be her duty in
that's
the
the whole
hospital.
point. Nobody's done anything. He needs to go. Nobody's around. She can't get somebody to come instantly, and she just goes out and gets it for him. And
Okay, okay. So
it's
she's
being
going
efficient.
beyond the call of duty to
Yeah,
help him.
exactly. And
Okay,
so
so that's
that's,
a,
yeah. I mean, when you gotta go, you gotta go, right? So anyway, thank you. I was just trying to make sure I wasn't out of whack. And this idea for this short story popped into my head. It was just like, oh, okay. Because I've dealt with being in the hospital with my son who had major injuries. I mean, not major surgery because he has mild cerebral palsy. And they were resetting bones and cutting bones and reattaching things. And it was torturous on both legs. So, and that was years ago. So I wanted to make sure I was current with the approach to how to handle it. Because he was there for a week because it was so extensive with his legs.
oh
And
wow.
yeah,
No.
it was pretty brutal. And the kid was only about 7. So he's
Oh,
getting around okay now. But originally he couldn't walk without holding on to things till he was 4. So it kept him getting ridiculed and teased and stuff at school, and it was hard. But anyway, I don't want to monopolize, but I thank you very much for your insights because it's like you just don't know unless you're involved with the field. And I didn't want to not write it. I had to find some way to verify things. So thank you both.
yes.
Thanks, Paula, and thanks.
And
Melissa.
yeah, and I think we have a question from Wendy in the chat.
Yes. Okay. She says a temporary contemporary romance. My character will be injured by a large falling branch and succumb to his injuries a couple of days later, but will be alert until his last breath. Is this viable, and what type of injuries will he have that will take his life? Okay, this is a really good question. Thinking if he has to be alert and something later, he could have. I mean, there are several different ways you could go about this. With lung, I mean, there are several lung things where he could have a punctured lung, something, um, pneumothorax might not do that. So that's some of this stuff is out of my specialty. Now he could have a weakening of his aorta and then have what's called an abdominal aortic aneurysm. You die pretty quickly from that, and that if he had some sort of injury, merely that's a great idea to be develop an infection and become septic. Yes, I mean he could just have a serious laceration or something where he's pokes into his abdomen and he has a breach where bacteria, you get a septic infection. And if you septic means it goes all over the body and they have trouble treating it. So that would be a great thing. And you would die suddenly about that. Yeah, trauma to the spleen, you would have surgery. I'm not 100% sure on that, but you would have a lot of bleeding. So I'm not sure how conscious that this person would be.
Where is the branch hitting him on the head or
I think
on the
she's trying to
shoulders?
figure that part out.
He they're in a vineyard, and he hears a branch creaking or breaking, and he pushes the girl out of the way, and it lands on him.
Okay, he could also have, like, a spine is my specialty. So he could
Mm.
have a spine, he could have a spine fracture. It could be, he could be operated on and develop a spinal infection. Um, but again, that would just be, I think an infection is a great way to go for him to, and really in any area. It could puncture his abdomen. It could cause him to break a bone. It could cause him to break his back. I mean, any of those things could lead to infection. And I think that would be reasonable, where he seems okay. And then all of a sudden he
Mhm.
gets septic and it's antibiotic resistant. and he has a problem.
Okay, so I would take him away in a couple of days.
It could.
Okay,
Yeah.
thank you very much.
Yes. What's it? Mara Lee gave us that one, which is very good. And I think in general, when you guys are looking for making sure you're medically accurate, I think when you have these issues, getting a provider who does this, like we can talk about different aspects, but I don't do some of these things. So like even for me, I wrote in my book, I needed cancer to make sure that my cancer patient was accurate. And so since I know a lot of medicalese, I can wade through, but I don't even know the details. So what I do when I am looking to incorporate a real life medical scenario, I'm looking for somebody that I can talk to. My neighbor happens to be an oncologist. And so I said, "Hey, this is my scenario," gave it to him. I need this to be realistic. What would it look like? So I think that you're not disrupting your medical providers to reach out. And so I would say reach out to the people that you know in your life. Do you know anybody who's in X, Y, and Z field? And if you can't find anybody, just family, friends, all that Facebook message. And then from there, ask your own providers, because I know that I would love, and I know most providers would, to be able to look over some passage of your writing or to have a quick interview. I've done that. I don't know if you guys know Abby Jimenez. She does a great job writing romance books that have medical things in them. She writes doctors, she writes nurses, she writes complex disease, and she will contact providers or find providers within her network and just ask them questions. And then to be really sure that you are being accurate, you get all your information, write it down, and then say to that same person, "Hey, will you read this over and make sure that this is accurate?" Because that is huge. Somebody out there will know that it's wrong, that can't happen, and then you lose your credibility. Because in the medical field, losing your credibility on that isn't something that you want. So that would be for these specific instances where you really want to be accurate. Definitely reach out for that expert's opinion. Now, also, you can use Google depending. So if you want to know how to treat a minor wound, Google will tell you. You look at a reputable site when you Google a .org, Medscape, or let me just Google real quick so I'm blanking out on my
Was that MD.com years ago? I think had a lot of that stuff on there. I don't know if that's current though, as far as, so many new websites come out. Also, if you're doing what Melissa suggests, always remember to give an acknowledgement in your book and to
Yes.
admit that any errors are yours, not the professionals.
Yes, that is exactly something that needs to be said. But mayoclinic.org is a good place to go. And then I will sometimes look at Healthline, because if you look at multiple websites and confirm that same diagnosis across the board, and then a lot of your universities, they'll have a .edu. Those places are places where they'll give you a whole lot of information on how to treat. And then you can reach out cold as well. So, for example, I had in this book that I'm writing right now, I needed a researcher. She's studying zebrafish for retinal regeneration. I don't know anything about that. It's along the medical side of things, but it's out of my field entirely. I looked up the lab that I am patterning my character, where she's working, where my character is working. It's a real life lab. And so, and if you're making up your lab, find a comparable, if you're doing that. So I looked up this lab. I looked up the people who worked in the lab or had research papers associated with that. I found this girl who works in the zebrafish lab on Facebook. I cold Facebook messaged her, and was like, hey, you're going to think I'm crazy, but I'm a writer. I need help in this particular field. And would you meet with me over Zoom or over coffee and tell me about your job? She was ecstatic to do it. And so I think that reaching out to make sure that your character or your disease is accurate is something that's totally doable. And I feel like a lot of people might not feel like they can do that, but I think a provider would love that. And then you're going to put them in your acknowledgments. They're going to be able to tell their friends, hey, I helped out with that fiction novel, or I helped out with that story. And I think that's fantastic. Okay, I've been talking a lot. Where do we
There's
want to go?
another question in the chat.
Okay. What about when writing historical? My novel takes place on a copper ship, 1840 to 1850. On the second in the series, typhoid fever is brought aboard and is highly contagious. They are at sea with a crew of nearly 60. It spreads quickly with many fatalities. I have had to wing many aspects of this. Okay, I would recommend getting a book that talks about typhoid fever. There are many accounts, and so I would read a book and get familiar with this disease, because if this is the main, this is what I'm talking about when you have something that is a major plot point, like you've got to get this right. You don't want to just wing aspects of this. Because if you get the wrong person reading, like if I'm reading your story, I don't know about typhoid fever, so I might believe you, and a majority of people might believe you, but the wrong person that doesn't, and they discredit you, then you don't look so good. So I would recommend doing some research, finding a book or a good article they've got to be out there. I mean, let's just Google it right now.
I've done some research on typhoid for some of my books, and there is information out there.
Yes.
Don't print out the pictures. They are ugly.
Yes. You have to be careful when you're looking at medical stuff, right? Because you will see a lot that you probably don't want to see. But you also want how typhoid fever would spread in the 1840s to 1850s, because if you're looking at it, like if you just look at Cleveland Clinic right now, it tells you that, it's an illness you get from a bacteria, high fever. But back then it would have been handled differently than it is now. And it's,
Yeah,
and it's
you did.
rare. So
You didn't have the sanitation back there, the hand washing and all that kind of stuff that you
right.
have today. And I think a lot of the caregivers back then, being unaware of the causes of it, weren't thinking about washing their hands and things,
Right.
and this kind of course it's going to spread very rapidly because of that.
Yes. And that type of detail, is immersive. That brings you into that time where everything is accurate. So yeah, the sanitation is different. What they thought they were doing might not be the accurate treatment. Okay, she says, imagine this on a clipper ship in the middle of the ocean. Yeah, I mean, that sounds like a fantastic story. But yeah, I think you definitely need to do just research on that time period. And there's got to be stuff. There's got to be stuff. Okay, what else do we have here?
Okay, so you say your specialty is spine. My husband had 3 back surgeries. I think it was the second one, they put some kind of a hinge in his lower spine.
Mhm.
Then a few years later, they had to take that hinge out and they put in like these hair clips that you put, only it was titanium and it surrounded
Rods and
his,
screws. Yes.
yeah. So,
Yeah.
I mean, to me, it's like a lot of the stuff in the medical field changes so fast today. It almost makes me question, if you're writing contemporary, how detailed you want to be. Um, it's just like a contemporary I wrote a few years ago. The BlackBerry phone was really like the high class phone. And so my hero had a BlackBerry. I keep thinking I should go back and rewrite that, but I'm not going to. But, that's one of the things you kind of run into with contemporary is how quickly it can be
Yeah.
outdated.
It is. medicine changes so much so fast. And so when you do include detail, you do have to be careful. So I think that's another really good point to think about is how detailed do you want to be? Because if you want to be really detailed, then you've got to really know your condition, or you got to really know the what a doctor or a nurse or a physician associate or whatever that your profession is that you choose. You've got to know what they do, or you've got to really know what is done for the disease that you're choosing. Because somebody's had that disease, right? Or that condition, and they're going to know that too. So yes, I think deciding how much detail you want is something that is super important, and thinking about maybe keeping it on the lighter side. And you can definitely do that and keep it immersive too. There are ways to do it, but it's also, there's something to be said for having the detail in your story, because that's really neat and it interests people to have the detail. But that means more research. That means talking to somebody who's been through it, or a provider who has treated it and knows how to take care of it in the modern day, and then can go back and look at, did you write this correctly? Okay. And then you can ask for stories. If you're talking, you have a medical provider's ear, ask for stories, and then make sure you're not using their story verbatim, and that you do get permission and that they know how you're going to be using the story. But that's a great way to kind of get a feel for what you want when you're not really sure. Yeah, detail makes it a learning experience for the reader, Veronica said. Very true. And they love that. I mean, there have been things, medical pieces that I've written that have pulled people in because of the detail that I was able to give. And so, yeah, you just have to decide. But yeah, doing deep research is important for that. And I wrote a couple of other things down. And then considering sensitivity, this might be something depending upon what condition you're writing, on whether you want a sensitivity reader for your condition. And that can go along with anxiety, depression, things like that, which is also medical. It can be in the medical field, or a disfiguring disease, or some sort of disability. You want to make sure you get somebody a sensitivity reader who understands the effect of that writing and can guide you on that too. So you don't want to get it wrong. Okay, those are a lot of my notes where I wanted to make sure that I covered that. What other questions do you guys have, or Paula?
Well, I write historical, so I kind of, do my research as best I can, and I really try to put myself in the mindset of the people at the time.
Mm-hmm.
That is different when it comes to contemporary. I'm quite sure there's a huge mindset to that too, because having had a husband who was ill for so many years, there is very definitely a toll that takes on the people around the ill person. Is not just the mindset of the ill person, it's all the people around them also. I noticed there was a time that my husband early on was always, I could tell the difference. It was like, I'm going to beat this. But after years and years and years, I slowly saw that mindset shift to more of an acceptance. And, that's a very sad thing to see. But that's, when we talk about medical issues, that I think just as important is to remember the people around your character and
Yes,
what that is doing to them.
I think you're right. There is caretaker fatigue, and there's caretaker whenever your life changes and you have anything happen, just like Shelley, we were talking about your guy, he was a motorcycle rider, and now his life has changed and he has broken bones. He can't do what he did before. And so that's a really great point, Paula, to talk about the mindset and the state of mind your character's in before and after something happens. Mm-hmm. Because that can also make and break your story. The emotional response, think about putting yourself, just like you said, Paula, in that position. If you lost function of an arm and a leg, you're not going to be jovial. You're not going to be, so how are they going to fall in love when when he is having those feelings and he doesn't quite feel like himself? So that emotional change is, I think, really important to write as well. When you have any sort of change within your health, you're going to feel that, right? I mean, we all do that. And I think if you don't capture that, just like I was talking about earlier with this person who had a serious injury, but they carried on as normal. That was a quick way to take me out of the story. That it's that cause and effect. This disease or this process or this injury affects you emotionally, and it affects the people around you emotionally too. And they're reacting to somebody's changes. So it's all this cause and effect that I think we need to.
Okay, we've got some more questions in the chat.
Okay. I have another question about a medical provider is obvious and who to report it to.
May I elaborate a little bit?
Yes.
Son on one of those painful surgeries I told you about had a guy who came in to pull out stitches, and he just ripped them out. And my son screamed bloody murder, totally incompetent. I mean, it was around the curve of his hip, and it was very, very painful. And I couldn't do anything to stop him. He just came in, no bedside manner. And my son has thought about him forever. He researched the guy.
Oh.
He was so bad. He was an alcoholic and he lost his license. But I'm thinking, gee, I could incorporate in that something. That's very dramatic. But at the time, I was just worried about my son's well-being. What would you do to respond to take somebody that out of the game before they hurt people? Well, who would you report it to?
That would be the hospital supervisor. If you're in the emergency department, you would want to speak to the head of the department. And then you would take it to but you want to make sure to follow up with your corporate, because there's a difference between the people who work as staff and the people who run the hospital. So you want to talk to somebody who runs the hospital. And then there's also the medical board. And that would be another place where you could make a complaint on that person's license to the medical board.
Well, I had a situation a couple of years back where I went in because I'd had a concussion. And I was in one of the waiting areas where they pull the curtain around and they take details. And there's this young fellow, looks like he's wearing scrubs, probably, you know, just new. And somebody's taking these down on the computer, and somebody's outside the curtain listening. And all of a sudden, and my husband's sitting next to me, so he witnessed this. All of a sudden, the guy comes charging up from the foot of the bed, starts feeling my belly, squeezing it. He did not tell me he was going to do this. He didn't explain. He didn't ask permission. I was
Wow.
infuriated. And at the end of the day, I wound up talking to somebody who was doing, outtake as they were going to release me. I refused to have them let me stay overnight and observe. I didn't want to be in that place any more than I had to. And I was so upset about the thing. I tried to get some redress. I approached the people. All I wanted was an apology. And the guy at night that I talked to was like a medical ENT kind of person, and he was very empathetic. But trying to get anything out of them, I think they could see I was going to sue them. But that's wrong, that kind of behavior. What would you do in the circumstance? Because all I got was a letter saying they refused to, I'm sorry, this has been thrown out. We're not talking about this. I couldn't get anybody to talk to me. I couldn't get anybody to be decent and human. He didn't hurt me, but that was totally unprofessional. I was very angry.
Yeah, I mean, that's terrible. I'm sorry you had that experience. I would talk to the hospital administrators.
I tried. They wouldn't listen because they're
Really?
covering their ass.
Right.
We have some more questions in the chat. Two more questions.
Yes. Okay. I have a question about premature birth and identical twins. Okay, Karen, let's talk about your.
Hi, thank you. So in my story, I have identical twins born in 1982. I have one of them born about 2 pounds, the other one at 4 pounds. The one at with 2 pounds has a small hole in its heart and eventually needs surgery. The twins eventually are separated, and they grow up and they're both fine. And I did, kind of research, um, how long a twin would be in there after surgery, or, how long would they be in the NIC unit. And um, so I had the one twin have surgery in July and had them be adopted like the beginning of November. Does that time frame seem too long? I guess it depends on if, there's complications or anything, but I didn't write any other complications in the story other than the surgery.
Yeah.
Um,
I mean, that sounds reasonable to me. Babies heal quickly. So if they're having a surgery and you're kind of staying on the surface level of this, you're not deep diving. The story's not about the surgery. It's not about that. It's about the adoption, right?
right, yeah.
And
So
yeah.
the twins were
So,
going to be adopted together. Um, they don't
but
because the twin has surgery, and the story builds from there.
and
Um,
so that one twin has to stay in the hospital. Plus, you said the one of them was a lot
short term,
smaller than the other ones. Yeah,
right.
yeah. So they would stay in the hospital too for that low birth weight. But yeah, I think you're on target there for them because of that surgery. You're not going into the details of it, so I think you're fine to kind of stay surface level and have that be a good excuse for that child to stay in the hospital. And yeah, they wouldn't be able to go anywhere. Have they would have to be at a certain birth weight, and they would have to be healthy enough to certain markers would have to be met, and you wouldn't have to go into detail for that. And then yes, I think that's a good reason.
Okay. Now I did read that I think the mother was a nurse and the child had had surgery, and they used some type of like salve or cream. And basically by the time they were adult, that scar was like nearly, visible. And in my story, these twins it's mistaken identity. So I kind of need that scar to not be there. So, is that realistic to expect that they would kind of grow out of that scar, or it would be almost nearly invisible with the right
Yeah.
type of treatment? And because
Mhm.
the person that adopts the baby is a nurse, so she kind of, knows like the different tricks and stuff.
Yes, I think that if you have a really good, well, I'm not sure how they would do surgery on a young child in, like if it is minimally invasive, you would have very small incisions.
Mm.
It depends on exactly what the surgery entails. That I do not know. But if you have someone skilled at suturing, so if you have an amazing person who's able to sew this child up, then and they're growing, I think it would be reasonable for that scar to go because you're healing really well at that time. So I think that's reasonable.
Thank you.
Yeah. Okay. Wendy asks, do you have any ideas about how to communicate with a young child, 7-ish, with a mom dying from cancer? Are there staff available to do that? What would be their title? Child psychologist. Yeah, definitely. A child psychologist in in the hospital. If it depends on the atmosphere, there are hospital chaplains that would come in, and that hospital chaplain would talk to the child, but then yes, they would definitely in the hospital. I don't know if they would come to the room or if they would be referred, but a child psychologist would definitely be involved. Does that answer what else do you have, Wendy? Anything else on that?
No, that's kind of what I needed. But if you're, um, I have another question. I don't know if you can answer about cancer. It's reproductive cancer, and it's caught late, and so I don't know how long. They go through therapy, chemo or whatever. I don't know how long the survival rate, from the diagnosis of stage 4 aggressive, and then it's not going to work, and they pass. So I don't know the length of that.
It depends on if it because the stages go with how advanced the cancer is, but also if the cancer has spread. So
Uh-huh.
when you have reproductive, a lot of times that's easily taken care of because they can just remove all the reproductive parts. But if it's spread, then that's where you come into the problem, because a lot of the reproductive, if it's in the uterus or ovaries, they can remove that and you're good, right? But you're going to have a problem if it has spread.
Mm-hmm.
And so if it's late, it would spread.
Yeah, if it has spread, I mean, what's the length of survival?
Where would it typically spread to?
That I do not know.
Okay.
But I don't know the length of survival, and I'm not sure. I would talk to somebody who is in this field
Mm-hmm.
and who would know this, because patients I know do differently. They're going to respond differently. Their life expectancy is going to be different. It depends on if there are lymph nodes involved. It depends on what other organs are involved, and it depends on how they respond to the chemotherapy. So I think those are the things that you have to decide what your patient would go through. And I think in that case, if you're going to be a little bit more on the specific side, you'd need to talk to somebody in that field.
Yeah. Okay. Thank you.
Yeah, absolutely.
Okay, let's see. Also, the type of cancer, small cell, is rapid, 6 months, and untreatable. Okay, Veronica, thank you for that. So we have just a few more minutes. Anybody else have any questions that they would like to throw at Melissa? I appreciate very much all of your insight, Melissa.
Well, I'm
And
glad to help.
yeah, it's great when, even not knowing the answers to some things, to be able to tell people, well, go to here or to go to there, because that's, sometimes half the battle is even knowing where to do the research or how to do the research.
I think that's the biggest thing. And another resource that I would recommend that you guys use, or a couple more, is Facebook groups. There are medical Facebook groups that people are telling all kinds of stories. And you can also make contact in the DMs with these people. And Reddit. Reddit is another great place where people are talking about these diseases all the time. And if you go to that, the topic that you are writing about, and you're searching in there, you can connect with somebody who has either experienced it or treated it. And that's another way you can have a side conversation. And sometimes it's just a few questions, in an email, and that's all that you need. But you do want to be accurate.
Okay, and then Shelley also asked, what do you hear about advances in aging issues such as dementia?
There are constantly, this one is tough, because I've been in traditional medicine for a very long time, but recently, and I know, Paula, you said you weren't sure what integrative and functional medicine is. This is a whole nother realm of medicine. When I was going to PA school, we didn't have any nutrition. We didn't talk about nutrition or preventative health very much. It was, if you have a disease, you get treated with different medications or different procedures, things like that. In integrative health and functional medicine, it's more on the preventative side of things. So, and I promise you, I'm coming back around to dementia. But
Okay, that's great.
how we treat things in integrative health is looking at what is that underlying cause that's causing this issue, and let's treat that. So there are lots of medications to treat dementia, but it depends on who you're asking as far as this aging process and advances in dementia, because in one traditional medicine that we have in the United States, it's very medication based, but this whole integrative health that's coming up is, hey, what if we took some supplements? What if we took a look at what you're eating and how your diet is affecting your health? And that is actually doing there's a lot of research in dementia on that as well. And I will say to this, it's not the same as dementia, but one provider had a multiple sclerosis. She was a medical doctor. She was losing function of her limbs. She was confined to a reclining wheelchair. She was deciding, she had all this training. She had all this time as well, because she used to ride bicycles and everything. She's in this reclining wheelchair, and she decides she's going to do research, and she looks at food as medicine. And she starts changing her diet. She starts changing what she puts into her body. And within, I don't, it was within months, she was out of the wheelchair. And within several months, she was riding her bicycle again. And I think it's similar for this idea of dementia, certain things that we don't expect to be triggers. So you can be revolutionary with this topic and take a different approach that maybe some of the traditional medicine does, and look at some of the new things that are coming out in the preventative health space, or looking at food as medicine. I think that is so, it would be more cutting edge, because we're just in medicine on the edge of this, and more providers are going to be jumping on this bandwagon, because it's not really a bandwagon, it's really true healthcare, because what we do now is sick care. Okay.
Melissa, what were some of those dietary changes your friend made? And I'm speaking from somebody I really care about. Her husband has dementia, and depending on what medicine's on, he can get very combative and be very dangerous to be around, and
Yeah.
lose his temper and lash out at her. So I was wondering if there are things she could change his diet subtly, so that might help.
And decreasing your inflammation is huge. And so when you do decrease inflammation, you're talking about inflammatory oils, a lot of things that we don't. Oh, yeah. What natural help could you put in a story with advanced RA and osteoarthritis starting as well? Okay. Advanced rheumatoid arthritis is different from osteoarthritis. And this is going to jump in with what Shelley is just asking for dementia, is that when we are looking at, yeah, I'm looking at the chat too, what Veronica said. You worked in HIV with naturopath. They advise no white, yeah, no white flour products. And I was going to say that. So decreasing inflammation, no gluten, no dairy, or trialing these things. So gluten and dairy are both highly inflammatory to the majority of our population. Man, they are delicious, but I have reversed my own autoimmune disease by going gluten-free. You also want to look at your inflammatory oils, like seed oils, canola oil, vegetable oil, and replace those oils and fried foods with things like avocado oil, olive oil, coconut oil. And those are always, and then there are certain things like curcumin, which is a supplement. It's very similar to like your Advil, ibuprofen, but helps, is a natural thing for the body. It's also a blood thinner, so you have to be careful, but it will decrease inflammation within the body. Exercising as much as you can produces chemicals within the body that helps decrease your inflammation. So having all these diseases that like are rheumatoid arthritis, that are autoimmune, and your dementia are sometimes helped by doing those diet changes, decreasing sugar, just 100% sugar-free, even the natural stuff for at least 6 weeks for a lot of these changes are great trials. They're not going to work for everybody 100% of the time. But when you are looking at trying to change some of these things, and also gut issues, that is something to consider. And yeah, it's not just diet. And Veronica said she's seen acupuncture do remarkable things. I think I'm on the fence about acupuncture, because I know some people really, but I need science-based stuff that it's changing for a reason. I haven't found where acupuncture does it, but
It
where
works with
acupuncture,
more with the meridians that medical science doesn't really
yeah,
recognize. But
exactly.
one of the other things, I can't remember what it was. I hate it when it comes and goes so dang fast. I guess it went and isn't going to come back. It had to do with that acupuncture thing, but yeah, I think everything you're saying is true.
Yeah. I mean,
Yeah, it is. I think we're getting to an age of people starting to realize that we are in charge of our health, and the medical profession is there to support us rather than to cure us.
yes. And I think that is a shift in the general population that we really need to have. And this is great. These are great story topics too, because when you're approaching medicine, everybody has done, there's nothing new under the sun, right? We hear that all the time. But if you can get on to something different or innovative, and this is definitely it. So when you look at things like this changing your diet, or if you look at acupuncture and you do some research into that, it's fun. Or, you know, essential oils. Some people are really think that essential oils have benefit. And I think to some degree certain things do. But it's amazing what's out there, and you can be innovative in that field of using your healthcare. But also, I mean, I know you're doing historical, Paula, and I think that's fun too. And getting those books, getting accounts of what has happened in the past, super important.
Yes.
Because some of the most popular books, oh, what is that? The Women? I haven't read The Women, but I see it everywhere by Kristen Hanna. And it's because she did a really good job with historical retelling. So you find that stuff that's out there that has been done, that has been documented by professionals and that are legitimate, and you use that. You really have to kind of have an aid, like we use you know, you have Romancing the Beat to write a good story, or you have these different romance plot books, or just storytelling, story grids. It's the same for adding medicine to your work. You've got to do the right research and find the right places to put it in there, and then apply it to your story. And then when you need to, have somebody who knows what they're doing take a peek to make sure you're doing it right.
All right. Thank you so much, Melissa. You have been so informative, and this has been a fun group. Great questions, everybody. I'm really glad that you didn't leave Melissa and me here kind of fumbling along by ourselves.
Well, I could
Okay,
start talking, but I wanted to help you guys specifically. This has been
okay.
so fun.
Yeah, so I will get this edited, cut off a little bit in the front, and get it up on YouTube. I hope tomorrow, Saturday, if not tomorrow. I'm wrapping up some final interviews for the Crime Thriller Authors Summit that will be in October. And I'm going to give myself a push here on Monday. We start promoting the next Writing Romance Mastery Summit, which will for the people who buy tickets, they can actually start viewing that on Monday. For people who want to watch for free, which you can, that will be available on the 19th. So, and this is, you know, all new interviews, all new subject matter, but we concentrate on writing, publishing, and marketing your romance novels. So I look forward to seeing everybody there.
That's so great. And I welcome any questions. You can go to melissacollings.com. My website is on there, and my website is on there. I just gave you my website. I think I'm getting tired. My contact info is on there. You can send me a message through there, and I would be happy to. And like I said, I am in one particular field, but if you have questions about something else, you know, I can tell you, hey, go and look for this person, or here's what you need to do. I might not be able to give you specifics, but if you've got spine issues or integrative health, I would be happy to help.
Okay. Thank you. Thank you, everyone. We ran a little bit over, but it was great. Thank you, everybody.